everyone, in this video I'll be explaining about selected topic which is meal test. Have you heard about meal test? Do you know what's the function and how it works? And do you have any idea about tennis elbow? No worries, in this video we will learn more about meal test and tennis elbow. Let's start! So, what is tennis elbow? Tennis elbow is a condition that causes pain around outside of the elbow. It's clinically known as lateral epicondylitis, and it often happens after overuse or repeated action of the muscle of the forearm near the elbow joint. Now, let's move to the prevalence of tennis elbow. The annual incidence of tennis elbow is about 1 to 3% of the United States population. Based on study, it shown that tennis elbow affect women and men equally. Then, previous study also showed that tennis elbow affect people aged older than 40 years old. In study on 2018, it showed that prevalence of musculoskeletal injuries at elbow area sustained by young squash player in Malaysia is 8.3%. So, do you know how the tennis elbow being examined by the doctor and other practitioner? Basically, the tennis elbow can be examined by using imaging tests, which is X-ray and MRI. It also can be examined by using physical tests such as Cozen test and meal test. So in this video, we will look deeper on the meal test. What is meal test? Meal test defined as a clinical maneuver for diagnosing lateral epicondylitis or tennis elbow. The meal test is named after the clinical findings by G. Percival Mills, who published his findings in the British Medical Journal in 1928. Then, what is the purpose of the meal test? The meal test is used to determine the presence of lateral epicondylalgia and help diagnose lateral epicondylitis, or more commonly known as tennis elbow. For the assessment procedure, it is recommended to perform this test in standing position with elbow flexion. For the step, first, use one therapist's hand to stabilize the forearm and palpate the lateral epicondyl using thumb. Then, passively pronate the patient's forearm. And then, therapist flex the patient's wrist. Lastly, extend the elbow maximally, and this will give attention on extensor carpi radialis brevis that aim to exacerbate symptoms. Now, let's look again on the step in conducting the test. For the result, the test is positive if patient complains of sudden pain at lateral epicondyle. For the evidence base, the sensitivity for meal test was found to be 53% and the specificity was 100%. Then, meal test showed significant area under receiver operator curve ROC, which explained that the test has good diagnostic accuracy. This validation study concludes that meal test has an excellent diagnostic value for ruling in lateral epicondylalgia. Furthermore, Cozen and meal test were used as a diagnostic tool and not as indicator of prognosis, and meal test position is often used during rehabilitation phase as a stretching technique. Lastly, in 1937, Mills originally described this test as a manipulation technique for patients with lateral elbow pain and limited elbow extension with the forearm pronated. He indicated that the limited elbow extension might be slight and have only a springy resistance to movement not evident on non-involved extremity. Mills concluded that some tense bands which were painful upon stretch were ruptured with the manipulation. It is not clear what structure in the lateral elbow region may be associated with the tense band. Mills clearly stated that this technique should not be used on patients with muscular pain in the region, and he recommended the manipulation be performed only if there was a limitation in elbow extension. As a conclusion, lateral epicondylalgia is a pain that described due to tendinopathic changes in muscle of extensor carpi radialis brevis as a result of repetitive strain commonly caused by manual labor or manual work as well as sports such as tennis. Hence, it is why it also known as tennis elbow, where clinical tests like meal test was done daily in clinical practice in determining the presence of it. However, the current studies about the meal test are lacking this day. So that's all for this topic. Thank you for watching.